My free paper on ocular manifestations in patients of HIV on heart. As you all know, HIV is a global health problem. Nearly 37 million people are of HIV worldwide, and 2.1 million of HIV people are in India. 21 million people are on heart worldwide. The lifetime cumulative risk of at least one ocular manifestations in HIV patient is 50 to 75%. The prevalence of ocular manifestation that has been reported in India in pre-heart era in various studies 40 to 100%. In post-heart era in northern India it is 38 to 45%. In southern India 37.6 to 52.2%. In western India it's 8%. The most common ocular manifestation that has been reported previously is CMV retinitis in various studies, whereas other studies have reported HIV microangiopathy to be the most commonest manifestation. But a recent study conducted in Thailand in the 2018 has reported dry eye, blepharitis and uveitis to be the top 3 most common disorder in the heart era. All of these studies, they have been conducted in a smaller cohort of patients. A recent study conducted in North India in 2017 has said that the spectrum of ocular manifestation has remained unchanged from pre-heart to heart era. They still report CMV retinitis and HIV retinopathy to be the most common infectious and non-infectious cause of visual morbidity. The purpose of our study was to determine the prevalence and spectrum of ocular manifestations in patients on heart and correlate these manifestations with WHO clinical staging, CD4 count, and duration and type of heart. The guidelines for ART initiation has changed over the past 14 years. Initially, it was when the CD4 count was less than 200. In 2010, it changed to less than 350. In 2013, it changed to less than 500. Now the current recommendation is treat all regardless of CD4 count of the patient. Our study was an observational cross-sectional study conducted on 350 patients of any age group on heart for a minimum of 6 months duration. The study was conducted from January 2017 to December 2017. Our examination technique included ocular history, ocular examination, and logistic regression was used to correlate different variables with the ophthalmic findings. Nearly 96% of patients were on stage 1. The mean CD4 count was 431, average duration of heart was 5 years, and nearly 87% of patients were on first line of therapy. The prevalence of ocular manifestation in our study was 15.71%. NTA segment manifestation, which included NTA segment as well as adnexal disorders, that was 10.8%. In posterior segment, prevalence was 4%. Both was 0.8%. The most common ocular manifestation which was reported in our study was dry eye, and the prevalence was 8%. Second most common manifestation was CMV retinitis, which was reported in 5 patients only. We have divided the patients into 2 groups with CD4 count greater than 350 and less than equal to 350. We have seen in both the groups, NTA segment manifestations were more common than posterior segment manifestations. Then we have correlated ocular findings with the clinical staging of the disease. Nearly 87% of patients who were on stage 3 and 4 had ocular manifestation. Thus, patients in stage 1 had lesser chance of ocular manifestation, and these chances increased with increasing staging of the disease. Then we have correlated ocular manifestations with line of therapy. Nearly 50% of patients who were on third line had ocular manifestation. Thus, they had a much higher risk of ocular manifestation as compared to those on second and first line. Thus, our study has said that there is a lower prevalence of ocular manifestations as compared to previously conducted studies, especially in northern India, and we have reported a higher prevalence of NTA segment manifestation than posterior segment manifestation. Probably we have got this due to initiation of heart at an earlier stage, and higher number of subjects were on long-term heart. Thus, early initiation of heart has resulted in reduction in overall prevalence of ocular finding, reduction in the opportunistic infections. The NTA segment manifestations have emerged more oftenly, but they too were mild in nature, and the heart has resulted in the improvement in the length and the quality of life. Thank you.